Hello everybody, my name is Violetta Baranska-Rybak. I'm professor of dermatology working at dermatology department, University of Gdańsk in Poland for 25 years. I've been teaching students, treating difficult cases of patients and following many clinical trials. I also own private clinic when I do aesthetic procedure and aesthetic related clinical trials. Today, I have a pleasure to share with you the results of my study performed with Sunekos Performa. I treated 3 different areas like forehead, periocular and neck. We all know that the skin aging starts at the age of 25 and it accelerates after 40. And the speed of the aging depends on many external and internal factors. And we do our best to slow it down as much as possible. We have a lot of different treatments, different devices we use in our patients, but as a dermatologist, I prefer to act on the skin, to act on fibroblast activity, to enhance extracellular matrix. And to do it, we have quite good solution, not invasive, that help us to restore extracellular matrix and induce collagen and elastin production. We all know that hyaluronic acid is a basic component of majority of biostimulators. And when we combine this hyaluronic acid with low molecular weight with amino acids, we can achieve much better results. I think you agree with me that amino acids are a key player in protein synthesis, in collagen creation, and also they are responsible for keeping the collagen in a good shape, but also in elastin production. And when we search through the literature, there are not so many studies proving the efficacy of products containing amino acids and hyaluronic acid published. Actually, I found 3 papers based on quite small group of patients, which I will introduce, and then I switched to my study on quite a big group of 60 patients. So the first study was based on 20 women that has been treated with mesotherapy with product which is a combination of hyaluronic acid, low molecular weight and amino acids. The patient underwent 3 treatments every 2 weeks and they had the skin biopsy before treatment and the skin biopsy 3 months after. They also were examined with ultrasound to check if the skin thickness has changed after those 3 treatments. And finally, after 3 treatments, skin density and epidermis density increased. Also, epidermal growth factor increased, but in ultrasound, the researchers didn't see any difference. The biggest published study, based on 40 patients, tried to evaluate the efficacy of hyaluronic acid with amino acids and vitamins on different skin parameters like hydration, density, microcirculation. And also 3 treatments were performed every 2 weeks, and actually hydration, elasticity and density improved after those 3 treatments, as well as global aesthetic improvement scales were quite well designed, and the doctors and patients impression were more or less the same. Majority of patients and doctor agreed that after those treatments, those parameters and the skin quality improved or much improved. There is also one study focused on neck. It was performed on 15 patients and published this year. And also skin density and hydration has improved after 3 treatments of hyaluronic acid with amino acids. My study was focused on Sunekos Performa, which as you all know, is an innovative product based on hyaluronic acid and 6 amino acids. And this solution promotes restoration and hydration of the skin, and also it has very good influence on the wrinkles depth. We all know that amino acids are key players in collagen and elastin synthesis, and in this product we have 6 amino acids with very selected amounts that has been patented. And to prove the efficacy and safety of this product, I designed 2 groups that has been treated with this product in selected areas like forehead, periocular and neck. I selected 2 groups and in each group I had 30 women, and one group was treated with 1 vial of product and the second group was treated with 2 vials. And I mentioned before, all patients were treated in 3 areas: forehead, periocular and neck. They all had 3 treatments, 2 weeks, being older than 18 years old, with visible mild or moderate signs of aging, that agreed to participate in the full 6-month study and sign informed consent. Exclusion criteria were also very typical, like pregnancy, breastfeeding, prior treatments with not biodegradable fillers, or treatment with hyaluronic acid 3 months before. Also, all inflammatory skin disorder, infections, both viral or bacterial, also no plastic disorders, systemic uncontrolled disorders, allergy to many products, history of alcohol abuse or permanent use of narcotics, non-steroid anti-inflammatory agents, and so on. And the primary objective of my studies were, first of all, to confirm the efficacy of Sunekos Performa injectable treatment on main signs of face skin aging at selected areas in adult women on the basis of subject satisfaction and the novel Aura 3D photos. Also, I wanted to estimate if the efficacy is dose dependent. That's why I selected those 2 groups. The secondary objectives of my study was to assess the safety of Sunekos Performa and also to confirm the clinical efficacy by measurements, mostly elastometry and corneometry, and also to check if those measurements will differ between those 2 groups of patients. This is the plan of my study. So as you can see, the treatment was based on 3 procedures 2 weeks apart, and after that we have follow-up visit with measurements and photos. To remind you, group 1 was injected with 1 ml at the periocular area, 0.5 ml per side. I used the small needle, 32 G4 millimeter long, and the average amount of the product per injection in group 1 was 0.015. In contrast to group 2, when I used the double dose and I injected it with total 2 ml of the product. On the neck, the first group was treated with 1.5 ml and the other with 3.5. And forehead, the first group was treated with 1 ml of the product, while the second group was treated with 1.5 ml. What you see here is not allergic reaction, don't worry. Some patients react like this just after injection, but 2 hours later there is no sign, no edema, no redness. And what I also observed after the study, the patient who react like this had a better final outcome considering the wrinkles depth. And I will show you at the picture in a little while. Considering results of my study. In both groups, the patient had a similar mean age, it was around 45. We measured height, weight, we calculated BMI, we also checked systolic and diastolic blood pressure as well as heart rate. All our patients were really healthy with normal weight in 73% of cases. Some patients with overweight, but it wasn't higher than 26% of the patient. Phototype 2 predominated, but in Poland is normal. We are phototype 1 and 2 mostly, sometimes phototype 3. And when we analyze the results on the forehead, considering skin elasticity, we noticed that in the group who received a higher dose, the results were better. Actually, the results were really good when we use also lower amount of the product, and the difference was statistically significant, but the better results were in the second group. It was even more visible in hydration. The level of hydration was higher in the patients who were treated with a higher dose of the product in the forehead area. And when you look at the picture, you can see really nice results, and I would like to mention that none of the 60 patients I included in the study was treated with botulinum toxin before. There was like native to botulinum toxin to have really real results. And when you look at the skin on the forehead, is not only the reduction of wrinkles, but also you can see the change of the skin structure. We can see it's more dense, it's lighter, and the color of the skin is much better after the free treatments. This is another older patient with also beautiful results just with free treatments with Sunekos Performa. And again, you see much improvement considering in the wrinkles depth, but also its skin quality. When we analyze the periocular area, I didn't find a statistically significant difference in elasticity in two groups treated with two different volumes of the product. Probably this is because of the specific skin under the eye. You know that the skin thickness at this area is very low, is 0.2 millimeter. So the number of fibroblasts we want to stimulate is very low. So we observe improvement in skin elasticity, but it wasn't dose dependent. In contrast to hydration, here I saw a big difference in the group treated with bigger volume of the product. The hydration was much higher, and it was a statistically significant difference. And when you look at the picture, you will see the nice reduction of the wrinkles, but also we observe the reduction of under eye shadows and big improvement on the skin color and the skin quality. Even here, the skin is much lighter, the wrinkles are more superficial, and it were just 3 treatments. This is the youngest patient. She was 23 years old, and she was treated with the smaller volume. She was in the group 1, so she received only 0.5 ml per side, and she was really impressed with the final result because the main problem were shadows under eyes, and after the treatment they disappeared, and the result was really long lasting. So I think it's a great solution for young patient and very economic one, because we don't need big amount of product for this group of patients. And this is older patient with also very beautiful results considering the skin structure and the wrinkles depth. And actually this is the best result in older patient considering periocular area with Sunekos Performa, and she is not smiling at the first picture. I will show you the full face, but This is the patient who had this big edema I showed you at the beginning of my lecture. She reacted with edema, but it lasted maximum 2 hours, but the final results in the aspect of wrinkle reduction is spectacular. And this is her full face. You see, she's not smiling. So actually, she's number one of my patient considering the result in this study. And as you can see, she doesn't have very thick skin, but the response is really incredible. And the last area I treated was the neck, and the neck was definitely dose dependent, considering the improvement in the aspect of elasticity and hydration. And when you look at the pictures, you can observe the very nice reduction of depth of the wrinkles, but also the skin color, the skin texture, the skin density. Here we see very nice improvement. It was done with 3D Aura device, and the quality of the pictures I think is very high. I think you appreciate it. And we observe very nice reduction with wrinkles and improvement on skin quality. When we analyze wrinkle assessment scales, considering all those 3 areas, we observe statistically significant reduction of wrinkles in both groups, but it was better in the second group when we use higher amounts of the product. And considering wrinkles, the best improvement we achieved at periocular area, but you saw it at the picture I presented during this lecture. So to conclude my study, I would sum up that Sunekos Performa is safe and efficient procedure in wrinkles reduction when we use 3 treatments 2 weeks apart protocol. It is also excellent to increase hydration and elasticity of the skin at 3 treated areas like forehead, periocular and neck. And the obtained results are dose dependent. The higher amounts of the investigated product gave statistically significant better results. Thank you very much for your attention. If you have any questions, please follow my Instagram and send me information. I will answer with a big pleasure.